welcome to today's lecture. Today we are going to look at what nurses do. As we are considering nursing as part of your career options, I believe you want to know what they do so that you will know what you'll be engaged in for the next 10, 20, 30 years of your life whilst working as a nurse. That is when you choose nursing as the career you want to pursue. So what do nurses do, or what's the role of nurses? We see them in the hospitals every day. And what do they perform? Some see the nurses as working with doctors, some see nurses on the wards, moving from patient to patient. What exactly do they do? That's what you are going to look at. Nurses provide professional nursing care to patients. In fact, the word care or professional nursing care encapsulates everything nurses do. It actually represents everything nurses do. And to me, when I mention the word care, some few things comes to mind. Words like comfort, support, assistance, relief. These are some of the things that I can use to present care, or I can use to explain care. In the next slide, we will look at some of the specific things that nurses do. So what are some of these things? They help to identify health problems of patients. Your nurse may observe you, ask you some questions, and perform certain tasks on you, all towards helping you to identify your problem, or helping the doctor to identify your problem. Another thing is that nurses also perform certain tasks, or there are certain things that tasks that nurses do. There are lots of them, hundreds and thousands of them. As I've listed a few here, they obtain specimens like body fluids, urine, saliva, sputum, wound swab, or fluid from your wound, blood, and send to the lab for analysis to help come up with your problems. They administer drugs, injections. I think every kid knows a nurse for a very bad injection or for the pain of injection. Every kid knows a nurse for having received a painful injection. In fact, injections are painful. Simple and complex dress. We also do dressing. We monitor patient vitals, body temperature, blood pressure, respiration, pulse. These are some of the things that we do. That's not the only task that we are involved in. We also help our patients to bath. We assist our patients to bath, and we also make beds for our patients and help them in elimination through catheterization. For them to urinate, we serve them uh, 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 bed pans for them to ease themselves. We also feed them orally or through a tube. So these are some of the few tasks that I will talk about. But hey, nurses perform a lot of tasks which I can't mention. When you go to nursing school, you get to see that there are protocols for doing all these tasks, and you have to be able to be familiar with them and follow it. All these things have reasons why some of these protocols are there. Also, nurses document. In fact, we document everything we do. The drugs you serve the patient, the task you perform for the patient, you write about your patient, write reports about the ward, everything we make sure that we document. Aside that, we also evaluate response to care. After providing our care to patients, we want to see whether we achieve the desired results that we expected. Also help in hospital management and ward management. So these are some of the tasks that nurses are involved in. As I have said earlier, nurses are involved in a lot of tasks, and there are a lot of things that nurses do, but only few of them have been listed here. You also realize that the things that have been listed here are all things done in the hospitals. Now, hey, nurses don't work only in the hospitals. Nurses work. There are lots of places there are lots of career avenues available to nurses. The next video or lecture, we are going to look at career avenues available to nurses so that you know what to do after completing nursing. Thank you. Do you also know any other thing nurses do? Please, you can write it in the comment section and I would love to read. Thank you.